Hi, everyone. Thank you for tuning into our presentation. My name is Lamia. I'm a UTSC alumni. I graduated in 2022, and I'm the co-founder of Creative Flow. I created this presentation to help people navigate our mental health system so that people feel confident in accessing treatment.
Hi everyone, my name is Siham. I'm also UTSC alumni. I graduated in 2021 and I'm also the co-founder of Creative Flow. Thank you for joining us for this series. We really hope to provide everyone watching with a more comprehensive understanding of how the mental health system works.
Hi everyone, my name is Coco. I'm a UTSC fifth year student in psychology, and I'm also the mental health educator at Seeds for Tomorrow.
Hi everyone, my name is Aksa Zahid. I am the founder of Seeds for Tomorrow, and I'm also a master's student in the clinical psychology program at the University of Toronto, Scarborough. So thank you so much for tuning into our presentation today called Navigating the Mental Health System. So before we get started, we want to just give a brief introduction about our nonprofit organizations. So I will go first. Like I mentioned, I am the founder of Seeds for Tomorrow, which is a mental health nonprofit organization. And our whole goal is mental health literacy. So our goal is to increase knowledge and education about mental health and the important role that it plays in our lives across different cultural and different age groups.
So just a little bit about Creative Flow. We are an organization that was co-founded by Lamia and I during the COVID-19 pandemic, where we won the COVID-19 Student Engagement Award and grant for our programming. Our organization focuses on hosting workshops, seminars, and creating programming to increase mental health accessibility, knowledge, and resources.
So before we get into all of the resources that are available to university students, we just want to give a bit of a background about the important role that mental health plays in our lives. So across university students, there is a high prevalence of mental health challenges, including symptoms of depression and anxiety, and this can have a severe impact on your academic achievements, your interpersonal relationships, and your well-being overall. In fact, in four university students have reported having thoughts of suicide, and almost 5% have actually attempted suicide. And there are a ton of factors that can have an influence on your mental health. And these on the screen are just to name a few. So there can be pressure to succeed either from yourself, your parents, your professors, supervisors, peers, etc., which can really have an impact on your own self-esteem. Post-graduation plans is another one, especially for third, fourth, and fifth year students, and trying to navigate what to do after you graduate from your undergraduate studies, if you want to go to grad school or professional school, or if you want to go straight into the workforce. Navigating all of that can be quite stressful as well. Academic performance is a huge one, especially for university students where we're taking all of these super challenging courses. So this can really have an effect on your self-esteem and your sense of self-worth. Financial burden and technology are other really major factors that can influence your mental health. We all know university is extremely expensive, especially for international students. And especially with the COVID-19 pandemic, having access to technological devices in your home setting has been another stressor for many students. And the final one that we have here on the slide is lifestyle changes. So a lot of people who are moving out from home, from their hometown or from their parents' homes and moving to a different city or different country altogether, face a lot of lifestyle challenges. And these can also result in feelings of loneliness and other factors that can influence your mental health. So because of all of these stressors and other common stressors as well, students tend to feel stressed, upset, or sad, overwhelmed, anxious, exhausted, and lonely. So many students actually refrain from accessing mental health resources on campus because of the potential of stigma. However, the university setting is a great place to build mental health literacy and facilitate the identification, prevention, and treatment of mental health problems. So what we want to do today is kind of give you some education and some tools in your toolkit to help you navigate the mental health system. So first, we want to go through the different types of mental health professionals. And here we have a few that we've summarized on the screen, but we want to kind of break down what exactly each of these individuals do. So first, we have a family doctor or a primary physician. So this is someone who can diagnose general anxiety or depression, and they can also prescribe medication, but they are not as specialized as a psychiatrist. So if you see on the bottom of the screen here, we have the definition of a psychiatrist. This is also a medical doctor who can diagnose and prescribe medications, but they are a physician who has specialized in the branch of medicine that's devoted to the diagnosis, prevention, study, and treatment of mental disorders. So a psychiatrist is a medical doctor, just like a family doctor who has specialized in psychology. And then we have a psychotherapist who is a licensed therapist who can treat patients through therapy interventions. A clinical social worker is someone who can treat patients through different therapy interventions. And we have a counselor who can give guidance on personal, social, or psychological problems. And we have a psychologist, a doctor who can diagnose and treat patients through specialized therapy interventions. So you might be wondering, like, a lot of these sound exactly the same, especially a psychotherapist and clinical social worker, but where they differ is in the training that they've received through schooling and what exactly they can do in their roles. So we've created this little table here that can really summarize what they are able to do. So a clinical social worker, a psychotherapist, a counselor, and a psychologist are all able to treat or provide psychotherapeutic treatment. A psychologist, a psychiatrist, and a family doctor are able to provide a diagnosis formally for a mental disorder. And then a psychiatrist and a family doctor can prescribe medication because they are med school attendees.
We also understand that sometimes these services can be pricey. So if you have coverage under OHIP or UHIP, you can always ask your family doctor to refer you to a therapist, which will be free of charge. So we have a couple of options that you can take. So first, obviously, as I've mentioned, you could book an appointment with your family doctor and ask for a referral to a therapist. And option two, our school offers a wonderful health and counseling services that will be covered in your tuition fees. And then option three, if you're already working full-time or opted into Green Shield insurance, you do have insurance benefits, or you can always use your parents' work insurance plans as well. And then I'm going to be focusing on our UTSG's Health and Wellness Center. As I've mentioned, we have a wonderful Health and Wellness Center where you can easily book a counseling appointment with your T-card and health card for a wide range of issues that you may be facing, either same day or not. And as I mentioned, we have our Health and Wellness Centers covers a whole range of health and mental health services, including allergy care, all ranging to sexual reproduction health, mental health, and even up to travel immunization and education. And then our campuses offers a wider range of resources to support you as well. So first, as I've mentioned before, we have a wonderful health and counseling center. And the second, we also have a EAP Optimal mobile app through which you can access the support of professional for all types of issues, including marital, family, addiction, or even work issues. And they can be reached at any time, 24/7. And then third, we also have a very targeted sexual violence prevention and support center that is open to all persons who are or have been affected by sexual violence or sexual harassment. And then furthermore, we also have our own very unique U of T mental health navigation system called Navi, through which it's a chatbot that will help you navigate to the specific services that you may require. And then UTSC also has offered a very comprehensive mental health network that's been put together by professionals, staffs, and students with a whole list of resources for mental health services on and off campus. And then we also have our wonderful university campus safety that is on duty 24/7, and you can always call them if you're ever in need.
Here are some additional supports that are available to U of T students. The first one is U of T telehealth student support, which was previously My SSP. This is free for all U of T students who have paid incidental fees, and it provides teletherapy over the app. You can download the app, fill in the application, and you'll be connected with a counselor. You can also call the 24/7 helpline. The second option is Green Shield coverage. If you are a U of T student and you have opted in for Green Shield coverage, you're covered up to 80% to see a psychologist, psychotherapist, or social worker, up to $2,000 every year. The next service is What's Up Walking, which is available to all students, which provides a free therapy service, either same day or next day, remotely via teletherapy or video call. And if you aren't at that stage where you would want to speak one-on-one with the counselor, there's different types of programming available to you at U of T. So the University of Toronto Student Life Center offers a wide range of services and programming covering topics from academic success and career exploration to health and wellness. One of the programs is called Better Coping Skills. So this is an online series which is available to students who want to develop strategies to develop better coping skills, and it's designed by health and wellness counselors. Another program is the Identify, Assist, Refer training, which is an online training which prepares you with skills and information to support individuals experiencing different types of mental health challenges. The next one is the U of T Mental Health Toolkit, which is divided into categories based on various types of resources. So you can choose how to get started, either by a podcast or an article or through other different resources. The next one is the OIZ Psychology Clinic. So this is a clinic that provides comprehensive and confidential assessment and intervention services to children and adolescents, and assessment and counseling services to adults. These are typically provided by graduate students who are doing their clinical training under the supervision of faculty and staff. These are dependent on the OIZ academic schedules. These services aren't covered by OHIP, but may be eligible for coverage depending on your insurance plan. And you can do that by leaving a voice message for the intake coordinator, and they will call you back and you'll fill out a form, and they will see if you're a good fit for the program, or they will refer you to different programming. There's also different types of international support in terms of mental health. So the Center for Innovation in Campus Mental Health provides resources to help those on campus learn more about student mental health and support international students. One of the options is the crisis text line, which is listed here, which you can access to seek mental health support. And there's also international suicide hotlines, and the link is also here as well.
We've compiled a pretty comprehensive list of a wide array of resources and services that are targeted towards different demographics and concerns. So I won't go through all of them just for the sake of time, but we'll point out some specific resources that may be of interest to you. So there's Nasiha Mental Health, which is a free confidential helpline for both Muslims and non-Muslims. They provide immediate support over the phone 12 hours a day, every single day, and they do a lot of other things, including hosting educational programming, workshops, web therapy sessions, and they also raise awareness within the community. There's two services here, Talk for Healing and Hope for Wellness, which are specifically targeted towards Indigenous people. And they both provide 24/7 services and support for those in the Indigenous communities. Talk for Healing is specific to Indigenous women, and it's all done by Indigenous women across Ontario. And then Hope for Wellness is more general for all Indigenous folks within Canada. And so another really good one to look at is the Good to Talk helpline. So this is a free and confidential support service, and it's particularly targeted for post-secondary students in Ontario and Nova Scotia. And they have their respective call lines and also text lines that you can find at the bottom of the table. And then we have Connex, which I think is another notable one. So this provides free and confidential health services for people that are experiencing substance use concerns, mental illness, and/or gambling issues. They are directly funded by the Government of Ontario. And their information service is live answer 24/7. It is always confidential and free. And then the last one to point out here is Ending Violence Canada. So this is a national Canadian organization that works to amplify the collective voices of those who believe it is possible to end gender-based violence. You can find more information about their services and their supports through their website, endingviolencecanada.org. So the last note that we're going to end off on today is about the diverse array of counselors and mental health professionals that exist in the mental health space. So we really want to emphasize the point that there are diverse professionals who not only have the clinical and professional training, but also share the lived experiences in some of the more identity and intersecting identity-based nuances to mental health burdens. So just at the very end here now, we have this quote, "Do not suffer in silence. Somebody somewhere is willing and prepared to help in any way to encourage, empower, and support you." And I think that really encapsulates our vision, purpose, and the take-home message of this Navigating the Mental Health System series. So if you do have any questions or would like some assistance or further elaboration on any of the resources we touched on, please don't hesitate to reach out to us at teamcreativeflow@gmail.com and seedsfortomorrow@outlook.com. Thank you so much for your interest and your motivation for learning more about the mental health system. We really hope that you were able to learn something, whether it be about the system itself or maybe a specific resource. Even if you didn't learn anything new and if you knew everything here that was presented, we really hope you pass off some of the knowledge to others in need so that we can all give each other a helping hand so that no one has to suffer in silence or alone.